I'm Mohamad Mohty from the Sorbonne University and Saint-Antoine Hospital in Paris in France. And it is my pleasure to be with you today and give you an overview about a study we presented during this last ASH 2021 annual meeting, namely the final results of the so-called DEFIFrance study. So just as a reminder, this is a real world data, real life registry about patients treated with Defibrotide in different centers in France. And the study included more than 700 patients. Among these patients, we have 251 patients who received Defibrotide for the treatment of severe or very severe veno-occlusive disease according to the EBMT criteria. And here we had some very interesting results, highlighting first the feasibility and efficacy of Defibrotide for the treatment of severe and very severe VOD, and this is in line with the label of the drug. But the other key information we have from this large registry study is that the results, whether it comes to the response rate, especially complete response, or when it comes to the percentage of being alive at day 100, which is a traditional endpoint in this kind of studies, well, actually the results are significantly better when it comes to the severe VOD group compared to the very severe VOD group. And I think this is an important message, which is in line actually with our current understanding and belief of this very complex disease, I would say, VOD, because it means that early intervention is crucial to improve the outcome of these patients. And although the drug can be effective at a later stage, like very severe, actually the best results are achieved when we have an early intervention. And that brings us actually to the issue of trying to identify, to detect and diagnose VOD very early in order to establish the appropriate monitoring and introduce Defibrotide whenever needed. Last but not least, the other important message from this large study was about the safety of the drug. And the good news is that now with such a large number of patients receiving it, actually the safety profile is definitely in line with what has been previously published and known about the drug. So no major or no new safety signal, and this is always, I think, good news. So in summary, we have here the largest, I would say, one of the largest registry-based studies when it comes to the use of Defibrotide, and clearly establishing the value of the drug, but most importantly, the importance of early intervention, because as we all know, veno-occlusive disease is a very serious life-threatening complication after stem cell transplantation. Although, by the way, it can exist outside stem cell transplantation after high-dose chemotherapy, for instance, or after using antibody drug conjugates like gemtuzumab or inotuzumab-based chemotherapy. But nevertheless, the key message, early intervention is crucial if we want to improve the outcome of these patients.